Okay, let's dive straight into this critical explainer today. We're talking about when minutes decide first aid for poisons, overdose, and sudden illness. We're going to unpack the absolute cutting edge of emergency response. And this isn't just theory. This is based on the absolute newest American Red Cross and American Heart Association guidelines. Because emergencies, they don't make appointments. They unfold in the blink of an eye, whether you're at home, at work, or just running errands. And having the right information in your head, well, it can literally mean the difference between life and death.
So right off the bat, we are throwing out the old rules. Because when minutes decide survival, you need the updated 2026 playbook to be the help until actual professional help arrives. Think about it. Think about the first aid classes you might have taken back in high school, maybe a decade or two ago. Yeah. Medical science evolves fast, and what we thought was the absolute best practice back then, well, in a lot of cases, it's been completely overturned by new evidence. So we really need to unlearn those outdated myths and replace them with proven, science-backed actions that actually save lives today.
Now, what's really wild about this is the total reversal on poisoning protocol. If you look at older first aid charts, like from around 2003, they explicitly told you to keep a bottle of syrup of ipecac in your medicine cabinet. The idea was to induce vomiting if someone swallowed a poison. But today, ipecac is totally off the shelves. It is completely out of the guidance. And why is that? Well, because inducing vomiting actually delays real medical care. Plus, and this is the scary part, it creates a massive risk of the person inhaling that poison right back down into their lungs. Doctors call that aspiration. So the new rule? Do not induce vomiting. Strictly call for expert guidance immediately.
Right, so if someone swallows something dangerous, please do not try to neutralize it with milk or charcoal or any of those random home remedies unless a professional specifically tells you to. Just don't do it. Instead, all you want to do is gently wipe any residue from their mouth. Then, grab the evidence. Save the pill bottle, the cleaning container, or even the leaf of the plant they just ate. You literally need to read that label directly to the experts. Make the call. In the US, you're calling poison control at 1-800-222-1222. Or if you're in the Kingdom of Saudi Arabia, dial 937. Just stay on the line, let the poison specialists guide you live step by step.
Okay, but the danger completely shifts when we're talking about inhaled toxins. Specifically, carbon monoxide. They call it the silent one for a reason. It is incredibly treacherous because it's completely odorless, colorless, and tasteless. You won't even know it's there. It triggers what basically looks like a flu without a fever. Headaches, dizziness, nausea, confusion. But the biggest telltale sign? An entire household suddenly getting sick, all at the exact same time. If you even suspect this is happening, you need to evacuate everyone to fresh air immediately. Just get out. Call 911, and whatever you do, absolutely do not go back inside to open windows or ventilate the place.
Speaking of inhaled fumes, you have to remember this golden rule. Your safety gates the rescue. If fumes are toxic enough to drop the victim, well, they're strong enough to drop you too. And two victims help absolutely no one, right? So if you have to perform CPR on a poisoning victim, always use a barrier mask so you don't absorb the toxins yourself. Also, let's talk about poison-proofing our homes against some modern threats. Bleach and pesticides have always been dangerous, sure, but you really need to lock away the new hazards right alongside them. I'm talking specifically about button batteries and liquid nicotine vapes, which are incredibly toxic, especially to kids.
All right, let's move to a massive update for 2025 regarding the broader category of overdoses. Bystander naloxone is now front and center in emergency response. It's a real game changer. If you see someone unresponsive and they've got those pinpoint pupils and incredibly slow or maybe completely absent breathing, you need to suspect an opioid overdose. Step 1, call 911. Step 2, if you have naloxone nasal spray on hand, use it immediately. And the most important thing to know here, naloxone absolutely cannot harm a person if they are not actually having an opioid overdose. It literally won't hurt them. So if you even suspect it, use it.
Now, if you administer that first dose of naloxone and the person doesn't wake up or start breathing normally, you need to wait exactly 2 to 3 minutes before giving a second dose. Just watch the clock. And here's a super critical reminder. Naloxone is a temporary bridge. It's not a permanent cure. The drug will eventually wear off, and those opioids that are still in their system, they can cause the person to stop breathing all over again. Because of this, getting emergency medical services on the scene is 100% still required, even if the person wakes up and seems completely fine.
Okay, let's talk about a brilliantly dangerous myth we constantly see in movies and TV: alcohol poisoning. Giving a dangerously drunk person a cold shower, or a pot of black coffee, or a huge meal, that doesn't sober them up. Actually, scratch that, it's worse. It creates a massive choking hazard. In reality, if someone cannot be roused, if they have cold, clammy, bluish skin, or if they're vomiting while unconscious, never ever just let them sleep it off alone.
Call 911. Roll them onto their side into the recovery position so any vomit drains out, and continuously monitor their breathing until help gets there.
Shifting gears to internal crises, let's talk about heart attacks. The absolute biggest mistake people make here is trying to wait and see if the pain goes away. Never wait it out. While we all kind of know that classic elephant sitting on the chest, crushing pain, you have to be aware that in women and diabetics, the signs can be much, much subtler. We're talking severe fatigue, maybe nausea, or even just back pain. Call 911 immediately. And hey, don't drive them to the hospital yourself. EMS treatment literally starts the second they arrive at your door. Keep the person rested, and if the 911 dispatcher agrees and there are no allergies, have them chew, not swallow whole, one adult aspirin.
Now, the absolute crucial point when it comes to a stroke is that treatment is entirely time-locked. Doctors only have this tiny window to administer clot-busting drugs. That's why you have to think F-A-S-T. Face. Ask them to smile. Does one side of their face droop? Arms. Have them raise both arms out. Does one drift downward? Speech. Ask them to repeat a simple sentence. Is it slurred or strange? And time. If you spot even a single one of these FAST signs, call 911 immediately and note the exact time the symptoms started. That clock literally dictates their treatment.
Moving on to seizures, and this is a really surprising fact you must remember, mostly because those old myths are just incredibly persistent. If someone is having a seizure, your job is to protect them, not restrain them. Clear away any hard objects so they don't hit their head, maybe slide off their glasses, but never ever put an object like a spoon or a wallet into their mouth. Swallowing the tongue is a physical impossibility. It just can't happen. Putting things in a seizing person's mouth will only break their teeth and create severe, life-threatening airway blockages.
And while you're protecting their head, be sure to look at your watch. You really need to time the seizure. A lot of seizures will actually stop on their own. But if the active seizing lasts for more than 5 minutes, or if it's the person's first ever seizure, you need to escalate and call 911 immediately. You also need to get on the phone with 911 right away if the person is pregnant, if they're diabetic, if they got injured when they fell, or if they just don't wake up after the shaking actually stops.
Now, fainting is another sudden illness, but it requires really quick, simple action. If someone complains of feeling dizzy, weak, or suddenly breaks out in a cold sweat, sit them down immediately. You want to do it before gravity does it for you. If they do faint, lay them completely flat on their back, loosen any tight collars or ties they may be wearing, and just check their breathing. Usually, recovery is pretty fast. It takes about 1 to 2 minutes. But if they don't wake up quickly, or if they fainted during heavy exercise, or mention chest pain, get EMS on the line for sure.
So what about hyperventilation? We have all seen that old movie trope of handing a panicking person a brown paper bag to breathe into, right? Well, breathing into a paper bag is officially out of the modern guidelines. Don't do it. Instead, you need to actively coach them through a belly breathing pattern to reset those oxygen levels. It goes like this. Have them breathe in slowly for 4 seconds, hold that breath for 2 seconds, and then exhale slowly for 6 seconds. This 4-2-6 pattern is incredibly effective at calming the nervous system down.
Let's touch briefly on food poisoning. Most cases are just going to run their miserable course in 2 to 3 days, and the best first aid is really just simple rest and small sips of an oral rehydration solution. Emphasize sips. Don't let them chug water, just sip it. However, you've got to watch for major red flags. If you suspect the poisoning came from wild mushrooms or improperly home-canned food, or if the person starts showing strange neurological symptoms like paralysis, blurry vision, or having trouble speaking, listen, that is not standard food poisoning. That demands an immediate 911 call.
Okay, as we wrap up this explainer today, I really want you to lock these 3 foundational takeaways in your memory, because sometimes knowing what not to do is just as absolutely crucial as knowing what to do. Number 1, no ipecac, no inducing vomiting. Call poison control instead. Number 2, time is heart and brain. For heart attacks and strokes, do not wait and see. Call 911 immediately and note the time. And number 3, Naloxone is a miracle tool, and it absolutely belongs in every single modern first aid kit.
So I'll leave you with this. Now that you know the updated playbook, if the clock started ticking right now, are you ready to save a life? It's a heavy question, I know. But emergencies, they just don't make appointments. They happen at family dinners, at the office, or just walking down the sidewalk. By replacing all those outdated myths with these modern science-based protocols, you aren't just the bystander anymore. Armed with this knowledge, you are now the vital first link in the chain of survival. Keep this info fresh, share it with your family, and stay ready. Thanks so much for joining me for this explainer, and I will catch you next time.